Thank you for joining me today. In this video, we are going to learn more about psychological resiliency and specifically medication mutual chronic stress pathway. Please join me and subscribe the channel. So we are going to explain psychological and biological resiliency and explain their relevancy to psychiatric practice. We're going to describe the neurobiological of the stress response, include the hypothalamic-pituitary-adrenal axis, autonomic nervous system, inflammatory pathways, and neuroplasticity. We are going to learn how chronic stress contribute to the developmental and maintenance of psychiatric disorders. We are going to discuss how the psychotropic medication indirectly enhances resiliency by restoring adaptive neurobiological function. We are going to compare the effects of antidepressant medication, anti-anxiety medication, mood stabilizer medication, antipsychotic medication, glutamatergic agency, and adrenergic medication on stress-related neurocircuits. We are going to integrate pharmacotherapy with psychotherapy and lifestyle interventions to improve long-term resiliency. We are going to learn more about developed individualized evident treatment plan that address both symptoms and reduces, and we are going to stress both symptomatic reduction and functional recovery. Resiliency is a dynamic capacity to adapt stressful to a diversity, traumatic and chronic or single life-changing events while maintaining and retaining a psychological, emotional, and physical function, rather than representing a fixed personal trait. Resiliency emerges from complex interaction among genetics, adaptational, neurobiological, psychological, social, and environmental factors. Historically, psychopharmacology has a focus on reduction of mental illness symptoms. Contemporarily, neuroscience has shifted toward a broad perspective in which medication may facilitate recovery by restoring adaptive stress response systems and enhancing neuroplasticity, reduction of a maladaptive fear response, and improve emotional regulation and supportive functional resiliency. It is important to recognize that no psychotropic medication directly create resiliency. Instead, medications may reduce biological barriers to resiliency, such as hyperactive stress circuits, persistent mood symptoms, sleep. So the medication cannot create resiliency, but it can reduce symptoms, it can reduce anxiety, it can reduce the it can reduce the barrier to resiliency, such as improving sleep, improving a cognition, and improving the mood, and improving the lowering the stress. That helps the person to develop a resiliency to the dramatical, diverse, chronic, or single life-changing events. That allows the patient to benefit more fully from the psychopharmacology, healthy behavior, supportive relationship, and recovery-oriented interventions. So the patient, when they have psychotherapy, when they receive psychotherapy, when they have healthy behavior, when they have supportive relationship, and when they have recovery oriented interventions that help them to develop resiliency. So psychiatric practice is to help the patient to develop that resiliency by providing them psychotherapy, healthy behavior skills, supportive relationship, recovery oriented interventions. Those will help the patient to have resiliency. What is the resiliency? Definition of the resiliency? Resiliency involves the ability to recover following diversity, maintain emotional regulation under stress, adapt to challenges, circumstances, preserve cognitive flexibility, sustain interpersonal relationship, continue purposeful function despite the challenges. Resiliency is influenced by genetic susceptibility, early childhood experience, social support, physical health, sleep regulation or quality of sleep you receive, coping skills, neurobiological regulation. So if some people are susceptible to stress and they have low resiliency to adapt to the stress genetically. Some people have early life experience that can influence how they can develop resiliency and can adapt to the stress. Some people have social support, strong social support that help them to adapt or to pass or to deal with stress. Sleep quality. You can tell when you sleep, you have more energy, you are more calm, you can deal with stress, your body is already rested, your mood is stable. So how the quality sleep that you receive can help you to have resiliency with adversity, trauma, life challenges. Coping skills. If you adapt coping skills, if you learn coping skills, if you been teach coping skills, And you can learn those. It's not what you learn when you were younger, but you can learn from now on coping skills that help you with the stress. Neurobiological regulation. Neurobiological regulation can also help you to either have a resiliency or not have a resiliency. So hypothalamus-pituitary-adrenal axis, or HPA axis, they regulate stress. The stress activity that hypothalamus. So hypothalamus regulate stress. Normal respond. Stress. So the hypothalamus responded to the stress. Corticotropic releasing hormone is released when the person feels stress. The anterior pituitary gland secretes AHT hormone. It secretes anticorticotropic hormone. The adrenal cortex also release cortisol. Cortisol is, as we know, is stress hormone. Cortisol exerts negative feedback to terminate the response. So cortisol will give you that negative feedback to terminate the response. This process promotes short adaptive to stress. So hypothalamus pituitary adrenal axis process promotes short-term adaptation to stress. Chronic stress, persistent stress may lead to sustained cortisol secretion. So you are going to release stress hormone if you are always working or in a stress relationship or stress at work. You are releasing that stressful hormone. Chronic stress embarrasses the negative feedback. It's hard for you to adapt to the stress and have that resiliency because you are always in stress, either your job or your relationship or a disease happening in your body cause you to have chronic stress. So that chronic stress will impair the feedback in your body to adapt to the stress. You will be releasing cortisol. Hippocampal will have a dysfunctional. The adaptation way that your body can adapt is getting weak and dysfunctional and negative feedback. And amygdala is hyperactive. Reduces the frontal cortex, cortical regulation. Then your body will develop inflammation because of that chronic stress. These alternations are associated with depression. Then that chronic stress will lead to depression, anxiety disorder, PTSD, bipolar disorder, schizophrenia. Either you will have these alternations are associated with. So this chronic disease will lead to mental illness, will lead to depression, anxiety, PTSD, bipolar disorder, schizophrenia. So brain region involving a resiliency. Where are the resilience? Which part of the brain that involves resiliency? Amygdala function is threat detection. So amygdala is the region in the brain that detects the threat. Fear condition is a center of fear condition, is a emotional silence. Chronic stress increase amygdala activation, contribute to anxiety and hypervigilance. So if your amygdala brain region is activated, that will cause you anxiety. You will be worried because your body tells you there is something wrong. Hippocampus function is learning. Hippocampus center is the learning, memory, conceptual process, regulation of a hypothalamus and pituitary and adrenal axis. But a long stress can reduce hippocampal volume and impair memory and stress regulation. It will be hard for you to remember. It's hard if the hippocampus is having a prolonged stress, that will affect stress regulation and will cause memory impairment. Frontal cortex of the brain function is executive function, decision making, emotional regulation, cognitive flexibility. So stress related reduction in a frontal cortex activity can contribute to impulsiveness, rumination, and impair coping skills or coping to the stress. Interior cingulate cortex contribute to error monitoring, emotional awareness, conflict resolution, behavior adaptation. Neurotransmitters and stress regulations. Serotonin contribute to emotional regulation, anxiety modulation, mood stabilization, sleep regulation, cognitive flexibility. Reduction of serotonin function is associated with increased vulnerability to depression and anxiety. Norepinephrine acute activation enhances vigilance and attention. Resistance over activation may produce hyperarousal, panic, sleep disturbance, sympathetic overactivation. Dopamine supports motivation, reward process, goal directed. However, stress-induced dopamine dysregulation may contribute to sadness and reduce motivation. GABA is the principal inhibitor neurotransmitter. GABA Reduced GABA activity contribute to anxiety, insomnia, increase stress sensitivity, hypervigilance, agitation. Glutamate is the principle of excitatory neurotransmitter. Excessive glutamate activation during the chronic stress may contribute to excitotoxicity, impair the synaptic plasticity, and cognition dysfunction. Neuroplasticity. Neuroplasticity refers to brain capacity to modify neuroconnection and respond to experience. The key maturation include brain-derived neurotropic factor, synaptic genesis, dendrite remodeling, neurogenesis, particularly hippocampus. So the chronic stress is associated with reduction of neuroplasticity. Neuroplasticity is the ability for you to adapt to stress, trauma, and adversity, where a successful treatment often correlate with improved synaptic function. Inflammation of the body and psychiatric illness. Chronic psychiatric stress, chronic psychological stress is associated with increased level of inflammation, include interleukin 6, tumor necrotic factor alpha, C-reactive protein, elevation, inflammatory markers. All this that I talked about earlier is inflammatory markers, have been linked to treatment-resistant depression and other psychiatric conditions. Although routine inflammatory biomarkers testing is not currently recommended for psychotropic treatment. Psychopharmacology and resilience. Psychotropic medication supports resilience by reducing a maladaptive biological response to chronic rather than directly increasing resilience. So psychotropic medication do not increase resiliency, but it helps you to have resiliency by having a better mood, having a low depression, having a less pain. So SSRIs potentially affect reduce the anxiety. So when you have a less anxiety, you can have resiliency or recover from trauma, disease, adversity, life-changing events, when you have a less anxiety, when you are less anxious. SSRI is an anti-anxiety and depression medication, so it improves mood regulation, so your mood will be better. Normalization of the hypothalamus and pituitary-adrenal axis. It makes normalize their regulation and activity over time. This medication does that. SSRIs also enhances engagement in psychotherapy. When you have a better mood, less anxious, and less depressed, you are able to participate in psychotherapy. You are more likely to take your medication. You are more likely to follow the doctor recommendation. Clinical implication. So SSRIs are the first line of treatment for depression and many anxiety disorder and PTSDs because they reduce the symptoms burden and facilitate adaptive coping skills, coping capacity. SNRIs, serotonin norepinephrine reuptake inhibitor medication, they have a potential benefit of improving energy, enhancing concentration, reducing anxiety, treatment of a coexistent chronic pain. That all when you get all this benefit, that will help you to have resiliency to trauma, to disease, to psychiatric disorder, to inflammation. You will have less inflammation. Glutamate modulation. For adults with treatment-resistant depression under appropriate regulatory programs, potential mechanisms include anti-NMDA receptor antagonist, increase glutamate signal through AMPA receptors, rapidly enhance of synaptic plasticity. Clinical effects include rapid antidepressant response in some patients, reduction of SI and select clinic setting, administration requirement monitoring because of the dissociation and transient blood pressure increase and sedation. Mood stabilizer medications like the lithium. Potential neurobiological effects include promotion of a neuroplasticity. That means lithium can help you it promotes neuroplasticity, and that help you to have resilience. Maturation of a intracellular signal pathways, reduction of a SI risks among individuals with bipolar, long-term mood stabilizer. Lithium remains one of the most evidence-supported medication for reduction of a SI in a bipolar disorder. Lamartine reduces glutamate release, prevention of a bipolar depression and relapse, and preserves cognitive function. Psychiatric medication, especially second generation antipsychotic medication, helps to reduce stress associated with psychosis by controlling hallucination, delusion, agitation, severe mood dysregulation that improve emotional stability. Prazolam is commonly used for PTSD. Benefit of prazolam include improved sleep quality, reduced nighttime hypervigilance, evidence for global PTSD symptoms improvement. So prazolam helps and relieves the symptoms of PTSD. Propranolol useful primarily for anxiety, tremor, and tachycardia. Tremor, tachycardia, and anxiety. And it's routinely used for trauma or PTSD because of the anxiety related to the trauma or PTSD and tremor and also tachycardia. Also, I have seen people who are having an alcohol withdrawal and who have a tremor and anxiety because of that withdrawal symptoms. They can benefit from propranolol. Benzodiazepine also has a benefit of rapid reduction of acute anxiety and short-term relief of agitation, arousal. But also it has the limitation of tolerance, dependency, cognitive impairment, and increased force, especially older adults. Sleep quality and resiliency. Restorative sleep strength, emotional regulation, learning, immune system function, and stress recovery. So when you have a quality sleep, when you receive a quality sleep, you can have emotional regulation, you can regulate your emotion, that can improve your learning capacity, it will improve your immune system, it will help you to recover from stress, trauma, and PTSD. When clinically indicated, treatment of insomnia may include cognitive behavior therapy for insomnia is the first line of treatment. So if you have insomnia, you can have cognitive behavior therapy for insomnia. It is where you can have you can adapt skills. Carefully selective medication is when the behavior interventions alone are not sufficient. So there is a medication also that can help you with the insomnia. Improve sleep often enhances daytime function and the capacity of engaging in a psychotherapy. So cognitive behavior therapy will help improve the maladaptive belief, catastrophic thinking, behavior avoidance, also trauma-focused therapy helps the cognitive process therapy, prolonged exposure. If you are scared of something, it can help you to eye movement, that it will relax the body when you have eye movement, desensitizing and reprocessing. Mindful-based interventions benefits include improved emotional regulation, reduction of rumination, enhances stress tolerance, and great psychological flexibility. Acceptance and commitment therapy promotes value-based behavior, adapt of internal experience, adaptive coping despite the ongoing stress. It will help you to adapt and commit to therapy. Lifestyle interventions that complement to psychotherapy include exercise. Regular exercise can improve the resiliency and improve adapting to stress, and regular exercise, strength training. Healthy nutrition can help your body to recover from trauma and disease. Consistent sleep schedule can help you to have quality of sleep. Smoke or drug cessation, reduction of alcohol and substance use can improve your body to recover. Social connections can help you to adapt to adversity. Stress management skills can help you to adapt stressful events. These interventions may improve the treatment outcome with combined with medication and psychotherapy. When you combine these interventions with medication and psychotherapy, can help resilience, can help your body to have resilience. I have a clinical case study for you here. We have 42 years old emergency department nurse present with persistent anxiety, insomnia, emotional exhaustion, depression mood following prolonged occupational stress. So this case shows us if you work prolonged emergency department and prolonged occupational stress can lead to persistent anxiety. And nighttime, when you finish the work and you want to sleep, you could not sleep because you are still anxious. And then you will get emotional exhaustion. And that leads to depression, mood. So assessment, when you assist the patient, she meets to DSM-5 diagnosis criteria for major depression disorder with general anxiety. There is no history of a bipolar disorder or psychosis. She never had any mental illness before this. What is the treatment plan? So the treatment plan that you can begin is initiate Zoloft with gradually increase. Then you want to refer her to cognitive behavior therapy to focus on stress management and cognitive restriction. So you want to refer her to have psychotherapy so she can adapt with stress. She can learn how to manage the stress. You want to recommend the cognitive behavior therapy for insomnia. You want to encourage a regular exercise and mindfulness practice. You want to monitor the symptoms, medication tolerant after you prescribe those medication. You want to also monitor the sleep. You want to monitor the symptoms. You want to monitor how she's tolerating this medication. You want to monitor also if her occupational function is improving. You want to also monitor SI risks, and you want to set up follow-up so you can assess those after the initial treatment. The treatment goal is not only symptom reduction, but restoration of adaptive function and resilience. You want her to have adaptive, functional, and resilience. You want to support her to have that. So, psychotherapy medication reduce biological barrier to resilience, but do not directly create resilience. Successful treatment combines medication with psychotherapy, healthy lifestyle behavior, and social support. Improvement in sleep often enhances emotional regulation, include emotional regulation and treatment engagement. Chronic stress affects multiple biological systems, include hypothalamic-pituitary-adrenal, autonomic nervous system, inflammatory pathway, neuroplasticity. It affected chronic stress affects all that. So the patient should be educated that resiliency develops over time through a adaptive experience, coping skills, and recovery, not through medication alone. So resilience, You cannot adopt resiliency medication alone. Recovery-oriented care focuses on symptoms remission, functional improvement, and meaningful relationship and quality of life. Resiliency is dynamic process supported by the coordination of a neuroplasticity, psychological and social mechanism. Chronic stress can dysregulate hypothalamus-pituitary-adrenal axis, alter neurotransmitter systems, impair neuroplasticity, increase inflammation signaling, contribute to wide range of psychiatric disorders. Psychotropic medication include depression, antidepressant medication, mood stabilizer medication, antipsychotic medication, glutamatergic agency, and adrenergic medications can restore more adaptive stress response pathways by reducing symptoms and facilitating neurobiological recovery. However, medications are only one of the components of resiliency-oriented care. The most effective treatment integrates pharmacotherapy with evidence-based psychotherapy, restorative sleep, physical activity, social support, and other lifestyle interventions to improve long-term recovery and functional resiliency and improve quality of life. Thank you for joining me today. I would love to see you in my next video. Please subscribe and join me again. Thank you.